Considering that the disease has now been classified as a pandemic, I have, as Minister for Health, invoked the Public Health Act. I therefore urge all Kenyans to observe the following. Number one is to regularly and thoroughly wash your hands with soap and water or use alcohol-based hand sanitizers. Maintain a distance of at least 1 meter, about 5 feet, between yourself and anyone who is coughing or sneezing. Persons with a cough or sneeze should stay at home or keep a social distance, but avoid mixing with others in a crowd. Maintain good respiratory hygiene by covering your mouth and nose while coughing and sneezing with a handkerchief, tissue, or flexed elbow. Stay at home if you feel unwell with symptoms like fever, cough, and difficulties in breathing. We have suspended all public gatherings, meetings, religious crusades, games, and all events that are of a huge public nature. No more church services can go on, provided that they provide sanitizing and hand washing as people go into the worshiping areas. We have suspended all inter-school events, in other words, school-to-school athletics, school-to-school events, but the schools at this moment remain open. Public transport providers are directed to provide hand sanitizers for their clients and regular cleaning of their vehicles. Let me add here that this is something we arrived at in consultation with the public transport people. There was a meeting between the CS for Transport. He's going to talk into that about matatus and so on. We are very pleased that they themselves say they are willing to do everything, including putting in their own money to ensure that people traveling in public transport are safe. We have suspended all visits to prisons for the next 30 days. We have also said, and we have repeated this before, we are repeating this, Kenyans must not abuse social media platforms or indulge in spreading misinformation that can cause fear and panic. We have placed travel restrictions outside the country unless absolutely necessary, and in any event, no travel at all to the areas, to the disease epicenter countries. And further on, we are going to be disseminating information on this issue on daily basis.